Hello, my name is Joseph EMMERICH. I am a cardiologist specialized in vascular medicine working in Hôpital Saint-Joseph in Paris. We will discuss today the ESVS 2023 practice guidelines on antithrombotic therapy for vascular disease that have just been published in May and are a very complete document that will be very useful to vascular surgeons, cardiologists, vascular doctors, as well as interventional radiologists. I would like to congratulate the authors as this guideline, as I sincerely do think that they are one of the most clear and easy to use in clinical practice. The 78 recommendations of this manuscript are very short and straightforward, as well as the flowcharts given in figures. Furthermore, these guidelines cover all fields of vascular disease, carotid and vertebral diseases, renal disease, and of course, lower extremity arterial disease. But these guidelines are not only focused on arterial disease, as they also include a chapter on antithrombotic treatment of venous thrombosis, the use of antithrombotics in vascular malformation, as well as a chapter on unresolved issues and future research. They do also include a very concise introduction, but very complete, with a review of all antithrombotic drugs, including their pharmacological properties. So it's really a remarkable piece of work performed with these guidelines. I would like to share with you the main message from these guidelines by going through the flowcharts concerning angioplasty in lower extremity arterial disease. I could have chosen also the flowchart concerning open surgery for vascular disease, as the main novelty from this guideline is that it is the first one to take into consideration the results of the COMPASS trials published in 2018 and the results of the Voyager PAD trial published in 2020, both studies concerning the interest of low-dose rivaroxaban, 2.5 milligram twice a day, added to 100 milligram of aspirin. This novelty is now included in the stable treatment of lower extremity arterial disease, as well as its use after revascularization. So you can see in this flowchart that during the procedure, it is recommended, of course, to use a bolus of unfractionated heparin or low molecular weight heparin. And after the surgery, aspirin plus rivaroxaban is recommended as a class 2A level B recommendation. And it is recommended not to add clopidogrel to aspirin and rivaroxaban for more than 30 days, and only in exceptional circumstances to continue this treatment for a longer time. You can also use post-procedural antiplatelet therapy plus clopidogrel without rivaroxaban for a longer time. So it is one of the novelty is clearly the introduction of rivaroxaban, 2.5 milligram twice a day, on addition to aspirin, as well as on stable lower extremity arterial disease or after revascularization, as it is recommended now by the French authority in France. So in conclusion, I would like to stress the point that dual antiplatelet therapy was a standard of care after peripheral arterial disease revascularization for at least 1 month. And the best evidence-based medicine now, improvement during the last years that is taken into consideration in this guideline, are the benefit of adding rivaroxaban 2.5 milligram twice a day to aspirin. Of course, as it is discussed in the guidelines, in the future research need to improve our knowledge on antithrombotic therapy after treatment of PAD. There is no direct comparison of dual antiplatelet therapy versus aspirin plus rivaroxaban, or even the direct comparison of clopidogrel versus the COMPASS regimen of aspirin plus rivaroxaban. It is discussed in the guideline and it's interesting, and we will need more study because the benefit of this approach was mainly observed after surgery rather than after angioplasty. And we must say that it is very important to stress the point that we need more studies concerning antithrombotic therapy after revascularization of PAD, as well as other medical strategies in this field. And this is really well emphasized in these guidelines. Finally, and in conclusion, these guidelines are really the 2023 state-of-the-art of antithrombotic treatments in vascular diseases, and they deliver a clear take-home message to every clinician in the field. Thank you very much.